My name is Dr. Mark Hamilton. I'm the Research Programme Manager for the Immunotherapy Initiative at the MMRF. My role in this initiative is to work together with our immune centres, or immune networks, to push forward the immune therapy for myeloma. That works in an area of trying to understand the role of the immune system in myeloma patients in disease progression and the response to therapy, to really try and build an understanding of how the patient's immune system changes through time and where we might be able to intervene or understand what kind of therapies are best for those patients. So my job is really kind of an interface between the MMRF and these multinational, multi-centre institutions to really kind of bring that research together, to work with these centres, to bring that information together and to help drive forward the use of immunotherapy in the myeloma patient population. Why immunotherapy now? In the last few years there have been great advances in the use of immunotherapy in the clinic, especially in the solid tumour patient population. We now have a better understanding of how to make immunotherapy work, even though people have worked in the immunotherapy space for a long, long time. We now know how to tailor treatments. We now have ideas about how treatment should look and how they work. There's still a lot of work to be done. There's a lot of things we don't understand about the immune system and how it responds to immunotherapy. And so we are at a point where it's not just a myeloma patient population, but for other solid tumours, where we really start to need to understand the immune system and its response to immunotherapy. So the immunotherapy has the potential to be curative. That's why we're in it now. Simply we're kind of at the beginning of really pushing immunotherapy. We now understand that immunotherapy works. Now we need to move to the point where we need to make immunotherapy work in the myeloma patient population. We're accelerating the use of immunotherapy in myeloma by bringing together some of the best myeloma institutions and researchers in the world together to form highly collaborative networks where information is generated and is shared. That information is held by us, and that allows other researchers, other institutions to be able to gain access to the information that will be generated, to analyse it, to develop hypotheses that can be tested in additional research studies with the view of making those findings or pushing those findings, the information from those kind of research studies, towards the clinic. We are basically the data holders. We are the means for people to gain access to data, and not just that, we'll have the aim is to have a large body of data that individual researchers can delve into. So we think of it as what we have in Compass or all our other genomic initiatives. The aim is to build a very similar, or very comprehensive and deep data set of information that can be analysed and can be interrogated, and from which we should hopefully be able to find potential answers or potential new questions that can be answered in the research lab, and move those solutions from those kind of questions towards the clinic.